Hey Yasmin, for our first series of pelvic floor exercises, we're going to start out with our Swiss ball, and we want to make sure we've inflated this enough that the crease of our hip isn't sitting below our knee, so we'd like the crease of our hip in line with or maybe even a little bit above our knee. I'm going to demo it a 3/4 view, and we are just going to do figure 8 hip circles on the ball, and so kind of tracing a figure 8 type position back and forth, driving our hips around, and then we can switch these into some big circles. And you can, of course, limit your range of motion or expand your range of motion based on what feels comfortable to you. So we are gonna do 10 rounds of, or 10 all the way around rather reps, one direction, and then we'll do 10 all the way around the other direction. So at this point, you can pause the video and do 3 sets, and then I'll demo the next exercise. Our next exercise is going to be a glute bridge from the ball. So for this, I'm going to lay on my back and dig my heels into the top of the ball. I'm going to drive my heels down into the ground as hard as I can. I'm going to take my arms and put them out at about a 45-degree angle. So rather than directly out to my sides or directly in line with my sides, I'm just going to put them right here. Drive my hips down until my butt's lifted a little bit. Drag my heels towards myself, squeezing my hamstrings. I'd like to do 3 sets of 8 to 12 here. You can pause the video and I'll demo the next one. The next exercise we have is really more of a stretch than a pure strengthening exercise. So for this one, I'm going to start in a tall kneeling position with my hands on the ball in front of me. I'm going to bring one leg up to the side, and you can bring this out to the side as much as you need to accommodate for your belly. You can also roll this away from your hands as much as you need to as well. We're simply going to use it as a prop to roll forward on and into our hip. So we're going to push into that hip and press back out. Push in and press out. I'd like to do 10 each side. We'll do all on one and then all on the other. You can also come down to your elbows here if you feel flexible enough, or if that feels more comfortable, you can roll forward onto our elbows as well. We'll do 3 sets of 10 here, and then we're going to move on to a quadruped position, and I'm actually going to set my ball aside for just a moment here. You should stay there for me, okay? Maybe we'll push him back in there. And for this next one, you can use a yoga block. I'm going to demo with a yoga block, but you could take a towel and fold it up, or a little stack of books or something with something soft on top. But really anything that's going to give you about 3.5 inches of lift is what we're looking for. So here, from a 3/4 angle, I'm going to elevate one of my knees and then take a quadruped position. You may have to make space to accommodate your belly depending on where you're at with that. You take as wide of a stance as you need to feel comfortable. And my feet are not perfectly straight behind my knees. They've rotated in a little bit, and you will likely have to externally rotate your hips some to accommodate, so that is also just fine. So from this one elevated position, I'm just going to rock back as far as is comfortable and rock forward as far as is comfortable. So just getting a bit of an offset presentation at the hip here, trying to create length and space on one side of that pelvic floor. We'll do 12 rock backs on one side, and then we'll switch sides and do 12 rock backs on the other. After we've done 12 rock backs on each leg, we are going to take more of a square position here, and I'm going to try to keep my thighs in line with each other as much as possible. So I don't necessarily want to be in like a counter stance crawling pattern. I want to be nice and square. And then from here, I'm going to draw my hip back into my pelvis, elevating that far side of my hip, pushing my knee into the block, and letting my hip drop towards the floor. We'll do 12 on each side, 12 on one side. For the other side, this is going to look like this. 12 on the other side, and then we'll do 3 rounds of this pair, 12 rock backs and 12 drawbacks. Actually, we're going to use this for our next exercise. So you can also use a towel for this. I would roll it up rather than folding it up. But our next exercise is going to be to take our block and apply some inward pressure on it. So I'm going to squeeze in on that block with my knees isometrically and try and breathe into my belly as much as I comfortably can with a relaxed exhale. Squeezing the block between my knees. Keeping a nice relaxed belly breath. Do one more breath. And then you can relax your adductors. We'll do 3 rounds of 3 breath squeezes there, and then we'll relax. From here, we can finish off with some figure 4 stretching. So because we start to get loss of space in the abdomen as we get more pregnant, sometimes this figure 4 where we pull our leg towards ourselves can become uncomfortable. So if you have room and it's comfortable to, you're welcome to do this. You are also welcome to bring this heel up as much as you'd like, and then to take this knee and gently press it away. So we're not trying to like crank on our hip or break our leg or anything, but I'm just gonna press that away from myself until I feel a stretch in the back of my hip, and then we'll relax, and we'll do that on the other side. So again, if pulling towards you doesn't feel good, you are welcome to take your hand, just gently press. And notice I'm not like pressing on my hip joint, I'm not pressing on my knee joint, but just kind of gently in the middle of the thigh until I get a stretch in the back of the hip, and then relaxing. We can also take a moment here to lay one leg out straight, let our other leg drop, and reach over our opposite shoulder. We'll take some relaxed breaths here. If it does not feel comfortable to let your leg lay all the way across you, you can again take foam roller, towel, yoga block, and support your knee with that as you do this stretch. So you can also do a supportive version here. You're welcome to hold these stretches as long as feels comfortable to you. If it starts, if anything feels painful or uncomfortable, obviously don't do that. If there are any other stretches you would like to do afterwards that are your own, you're welcome to. I'm gonna also send another video that's more stretch oriented, so we'll also have some of those later this week.